this is Dr. Gosh at Bella Medici Medical Spa, and I have one of my really favorite clients with me today, and we just wanted to talk a little bit about kind of her story, our story here at Bella Medici. So Andrea has been a client with us since April of 2022, so 3.5-ish years, and there's been kind of a whole gamut of things that we've helped her with. And just kind of want to give you a story of the things that we can do here at Bella Medici, and just a little bit about us. So I've had my med spa for 12 years. I was in Branson for 8 before I moved here in mid 2021. And I've been here in Ozark ever since then. We've expanded the services that we do here, and we try to do very intimate patient interactions and really do specialty care and try to fix inside, outside, everything, and just make people really feel better. And that's just my goal personally, is to make my clients feel better, make them my friends. And so,
and she definitely has. Coming here has just helped me, not just with the outer beauty that they can do, but I was so sick with the people that follow me know that I had ITP about 3 years ago, and I had gotten it after COVID, and I came in to get some things done, and I wanted some energy. After COVID, I didn't have any, and I had started having bruises all over me, and her receptionist had said, "Oh my gosh, you need to get blood work." And at that time, I didn't even have health insurance, and they were so kind and so nice to actually send me off, and it was like $17 to do. And Dr. Gosh, she's like a miracle worker for me. You are. She's become such a good friend that she has helped me tremendously. She called me and said, your white blood count is 17. You really need to be seen. So then, it was like a 5 to 6 month journey of getting over ITP, and her constantly answering my questions and my calls, and we really became good friends.
for sure.
Then, if everyone that knows me knows that, 5-6 months ago, my life kind of went, but it was for the best. And normally I do videos with dogs and my granddaughter. And this time, from having the ITP and all the stress that I've had has really, I feel like, aged me even more. My neck has just been awful. And so she knows it's been bothering me. And we've done the PDO threads before, and they're good, but they don't last.
Yeah, that's how things started. She didn't like the loose skin on her neck,
No.
and so we've done I think 3 or 4 rounds of threads on her neck, and threads work great, but they only last 6, maybe 12 months. So we've been working on other things.
And she has suggested we do this.
Yeah, we've got some upcoming stuff as well that we're going to add to the improvement of her neck. But we've done anything from hormone replacement therapy on her, getting the labs to see where she was at with the ITP and finding the low platelet count, and getting her directed to the right people to get her treated for that. With the hormone replacement, we've optimized her hormone levels so that she feels better with that.
Yes,
so it's just more than just fixing the neck.
Yes, the pellet that I come every 3 months and get my blood work done, and then she puts a pellet in, and it gives you so much more energy. And at 59, the brain cloud that comes with it, and just it makes you sleep better. Just no night sweats, nothing. And so that's kind of like a miracle in itself too. And it's only like $350, and it's really worth it.
Yeah, and
I highly suggest it.
How would you say, like, the procedure to get the pellets put in? Is that something that's
It's so
a
easy.
big deal?
Oh no, it doesn't hurt at all. No, it takes like 3 or 4 minutes.
Yeah.
No, not even that. It's just real quick, and at the top kind of your upper hip, and it's nothing. It's nothing. So I highly recommend that. That has helped me more than anything, as far as probably just keeping a better mindset. The best that I can, that's for sure. But I wouldn't be here if it wasn't for her, that's for sure. She has helped me.
I really appreciate that. And I do. When I work with my clients, I try to sit down with all of my clients in the beginning when I meet them, and just get to know them and find out the things that bother them. And that what they're there for today may not be any of those things that bother them, but we have other things to offer that oftentimes we can help. And so I'll always provide that information for them and invite them to come back, you know, if anything changes and they want to readdress other things. And you know, it's not my job to decide what bothers an individual, because everybody has different things that bother them. So I always want to find out what bothers you first, and then give you my opinion as far as the things that I feel that will fix that.
Well, she's always right, by the way. I should have listened like last year, and because what I'm going to do to my neck, I should have done it a year ago. But so now you can follow my journey.
So we'll talk about her journey with her neck. So when the silhouette threads were introduced into the United States, it's been about 3 years ago. They are an incredible thread. They're better than the PDO threads. They are what are called bidirectional, meaning they have a cannula on both ends. They have barbs that go both directions, so you can get pull in multiple different planes. So we did several rounds of threads where we did her lower face and did under her neckline, and they get fabulous results.
Very, very well.
But the problem is it's temporary. It might last a year, so you have to keep doing that. So we did that, I think 3 or 4 times, and the last time I did it, we had started doing Beautifirm, which is a laser skin tightening procedure, and I was trying to, you know, let's not do this, let's do the Beautifirm. And she was, you know,
I want it right now.
I really don't want to do that. So we did the threads again, and I knew, you know, as you age, you have less connective tissue, less subcutaneous fatty tissue to grab onto the threads, so they don't hold as well. So I don't think that they didn't take as well. They didn't last as long, and so we're approaching things a little bit differently now. So we have done other things with Andrea. She's had neurotoxin. She's had some filler under her eyes. We have done a little bit of restructuring, not a lot of like cheekbone restructuring, that sort of a thing. Yesterday I did do some jawline contouring to give her some added lift to pull things back, because the things that bothered her were when she bent down, they'll do skin on the sides of her face and on the sides of her neck. But just that alone helps lift things, helps pull things back. And then the next step is in, I guess, a week.
Yeah, in a week.
Yeah.
Today.
The next plan is we are going to do the Beautifirm finally. So I'm actually so excited for her.
Yeah, because I just liked my neck for so long.
Yeah, and it'll be a permanent fix.
Right.
It'll be a permanent fix. So going in with the Beautifirm skin tightening laser, we'll tighten that skin. If there is any fat, we'll get rid of that. She doesn't have probably more than 4 fat cells, but we'll get rid of what we can. But then the laser will tighten the skin, and it will pull it up so she won't have that laxity again. And so I'm really excited about the journey that she'll have.
But I may look silly when you see me out for a couple weeks.
Yeah, she'll have to wear a head garment. It's just a compression garment for a couple of weeks. So and then after that's 4 weeks for just at night. So only 2 weeks of looking funny. But you might look. So yesterday we did jaw contouring.
It made a huge difference.
Yeah, and I just did Volux, which is a deeper, thicker filler. Her jawline basically was more straight. She had lost the angle of the jaw. So yesterday we built up the jawline here just to help pull things back.
And it really worked.
And also lift, but to give me a defined line as to where I want to go with the laser as well. Because I don't want to take any of that away. I want to contour up against that. And that's the goal when we do the Beautifirm. We come in with a laser underneath the chin, just under the ears, and we work on this entire neck area. So all of this skin will get tightened. So any of this laxity that she's got will all be tightened up against the contour of the neck. So she's gonna, whatever loose skin she has left is gonna go away. And it will be the nice thing is with Beautifirm is it's a permanent thing. I mean, as long as you keep up with your good skincare, it's not gonna change. And it's as good or better than having actual plastic surgery. You could have a neck lift, but you would have 8 weeks of downtime, lots of pain. The expense is probably 4 to 5 times the cost of what it would be to do just Beautifirm by itself. So it's just there's so many advantages of doing the Beautifirm over an actual neck lift. So many advantages.
Right.
And so we've been working towards
Yes,
this
she has. She's
for
been trying to get me to do this
about
for
a
over
year.
And I didn't want to have to wear the thing for 2 weeks, and I was like, well, you know what?
Yeah,
I'm just gonna do it.
I have some clients that have become very good at covering that up. Yeah, disguising it. If you pull your hair back and you find yourself a pretty wig, you put on a wig and a scarf,
Yeah,
and you can't see it.
When I take JJ to kindergarten.
Even you can't see it. You put the head garment on, you put the wig on over top, and nobody can see it.
Right, there you go.
If you have to go somewhere,
Right,
because
well.
she's a performer, so it worked out well. She figured
Well, that was good
figured
for
out,
her,
showed me this is how I disguise
Yes,
it.
you
Yeah.
can tell your clients,
Yeah.
put a wig on.
Yeah. So that's our next step with Andrea is we're going to do Beautiform on her neck. So we probably won't have it. We'll have some befores and some during the procedure next week while we're doing it to kind of show the whole story. And then the following week when we do follow-ups, we'll get some follow-up photos 1 week out, and we'll keep
I'll get
doing
to take that off.
Yeah, we'll take that off. But we'll follow that journey through.
Yes.
And then
And in 6 weeks, I will have a great looking neck.
for sure. Yeah. Then the next thing with Beautiform is the results are immediate. There's some skin thickening that does occur, but it goes away after a few weeks. But the tightening is immediate.
Right, the goggle turkey neck.
The
It'll be gone for Thanksgiving.
It will be. No turkey neck for Thanksgiving. Yeah, not this year.
Yeah.
Not this year. So
Be gone.
yeah.
All
So
because of her. And I
Wow.
must really tell you, she is wonderful. Like, I cannot tell you enough. She
Oh,
is the nicest
I
doctor I've
appreciate
ever
that.
met in my entire life.
I appreciate
And
that.
I highly recommend coming here. Everyone is so nice. But like she said, she's been telling me for a year, I need to do this and stop doing the threads because it's kind of a waste of money. If you just, it's just a temporary fix.
For sure.
And
for sure.
finally, I'm like, whatever. I'm changing my life. I might as well start with a new neck.
Yeah.
I loved it through here. I didn't like, this will all be pulled up.
Yes, I really like to, I don't want people to throw their money away on things that aren't going to give them the results that they really, really want. And so on the services we offer, on the products that we carry, they might be a little bit more than like a regular day spa, med spa, but I know they're going to give you good results. And that's what I want. I want to under promise and over deliver.
Right, and that's what she does. She's fabulous.
That's what I like to do. And I love to establish a relationship with my clients so they feel comfortable. Call me, text me, it doesn't matter, middle of the night, whatever,
and I probably
whatever
did a little too much, but
no.
I was like, what do I do?
No.
She's just helped me so much through seizures, all kinds of things, through stress this summer, and I cannot thank her enough, that is for sure. So I want to once again say I highly recommend this place, and she is definitely not just the best, but the nicest doctor. Oh, it's true.
Oh, I appreciate that so much.
You're a wonderful person.
Thank you. Well, so we will continue this story in a week or two. Next week
we'll watch.
Yeah, next week we'll do some more.
Okay, and plus she doesn't knock me out, right?
We're going to do nitrous.
Yes. Nitrous.
We're going to do nitrous. So she can literally drive here. We'll do the procedure. We will use nitrous to sedate her. As the nitrous wears off, once she's awake, she can drive home.
And no, that means I get to go pick up JJ from school.
That's very cool. Yeah, she can drop her off at school.
Walk inside
we'll do a
with my new
procedure and she can pick her up from school.
Yeah,
How cool is that?
Yeah, don't need a
How
driver.
cool is that? So much different than having surgery.
Right. Oh my gosh, yeah. I can just do whatever.
Yeah.
Go take care of JJ and all the dogs.
There you go. Well, stay tuned and we will keep you guys
Thursday.
posted. Yeah. Thanks for listening.